Everyone, my name is Leah, and today I'm going to be talking about the psychological impacts of multiple sclerosis, also known as MS. But let's take a step back. What even is MS? MS is an autoimmune disorder characterized by the attack on the myelin sheath of neurons in the central nervous system. This leads to both physical disabilities and psychological challenges, which we will be looking at through the lenses of neurochemical changes, cellular alterations, and neuroanatomical effects. In the past decade, more research has emerged on the effectiveness of DTI, or diffuse retention imaging, in regards to quantifying parameters of demyelination and axonal loss. DTI is a non-invasive MRI technique that maps the brain's white matter pathways by measuring the diffusion of water molecules. It is able to identify MS lesions with severe tissue damage, along with being able to detect changes in the normal appearing white matter. This is a photo from a monumental study done in 2013 that showed that the adoption of DTI may represent an extremely important step forward in the MS research field. This image shows white matter bundles in the brain from a patient with MS. Typically, when people are discussing multiple sclerosis, they tend to focus on the physical symptoms that are a part of this disorder. When you think about it, that makes sense. The physical effects are easier to see. However, there are many psychological effects that are just as prevalent, which is what our focus is today. Two of the main effects research has looked at are the prevalence of emotional distress and cognitive dysfunction challenges. From a neurochemical perspective, MS alters neurotransmitter levels, notably serotonin and dopamine, which play critical roles in regulating mood and cognitive functions. These changes can lead to increased feelings of anxiety and depression, significantly impacting the psychological well-being of individuals with MS. In this particular study, an anti-inflammatory agent called gogolsterone, or GST, was administered and tested in rats in order to stimulate the effects of MS. The GST greatly improved the behavior deficits like spatial cognition, memory, grip, and motor coordination of the rats, and reduced harmful proteins while increasing protective proteins. It showed that GST could be a potential alternative drug candidate for MS-related motor neuron dysfunctions. Another important aspect for understanding the psychological aspect of MS includes looking at it from a cellular level. Research constantly brings up these three changes that occur throughout the progression of MS. The first being demyelination, which is the loss of the protective myelin sheath, which disrupts efficient nerve signal transmission, and thus leading to physical and cognitive impairments. Another being inflammation, which is an overactive immune response that contributes to cellular damage, which exacerbates both physical and psychological symptoms in patients. And finally, neurodegeneration, which is the progressive loss of neurons that can significantly affect cognitive functions and emotional regulations in individuals with MS. A while back, we talked about BDNF in class. BDNF is a protein that acts as a growth factor for neurons. It is crucial for the survival, growth, and maintenance of neurons in key brain regions involved in memory, learning, and higher thinking. In this study, researchers wanted to administer BDNF in order to enhance remyelination and improve cognitive function. They used 60 mice, half of which were on a special diet which promoted demyelination. The BDNF was found to enhance repair cell growth and led to thicker nerve sheaths. It also preserved cell energy and regulated inflammation. The results showed that the administration of BDNF enhanced nerve repair, thus indicating potential for MS treatment. MS causes brain lesions in white matter and the spinal cord, disrupting neuron communication and leading to neurological symptoms. The thalamus is a key target for neurodegeneration and multiple sclerosis, often occurring early and acting as a strong predictor of disability and cognitive impairment. This study showed that the thalamus was disproportionately affected by demyelination, and neuronal loss was greatest in the lateral thalamic nuclei. High concentrations of complement in the inflamed thalamus point to its contribution to neurodegeneration and ongoing pathology. This also led to patients with MS dealing with memory issues, fatigue, and movement difficulty. More research has come out recently observing patients with MS and the psychological disorders they deal with that have been associated with MS. Research from Johns Hopkins Medicine has found that patients with MS, there is a 25 to 50 percent prevalence of depression, 35% to 40 prevalence of anxiety, and the Cleveland Clinic found that 40 to 65% experience cognitive impairment. These statistics are just a glimpse of the challenges that come with this disorder, which is why it is crucial that patients with MS have accessible coping and support strategies. One strategy involves utilizing CBT in order to address emotional challenges and enhance coping skills. Another is engaging with support groups to foster community connections and share experiences. And lastly, considering looking into certain medications for psychological symptom relief can be a great coping strategy for patients with MS. In regards to the future, further research is needed to truly understand all of the psychological impacts of MS, but there have been major strides in the past decade, which makes me hopeful for the future. I hope you learned a lot from this presentation, and thank you so much for listening.